Hi again, this is Max at PT Connections here in Pueblo, Colorado. This is another couple of common questions I get asked throughout treatments every day is, that my shoulder's popping. I'm just going to use the shoulder for example. My shoulder pops, is that okay? Is that all right? Well, one, it's okay as long as it doesn't hurt. If it hurts, then there's a little concern because there's a reason why it's popping and it's causing pain. So there's a reason. Other reasons is, especially after surgeries, swelling occurs. So it doesn't pop because one, it doesn't move. You need mobility first. But once that swelling goes down, your mobility increases. So another reason why I tell patients too is because your mobility increases. Is I always use the analogy of people that are hoarders. Just imagine this room as being hoarded full of furniture, boxes, and just a bunch of just junk. Well, that's like before surgery. After surgery, it's like after they clean out the hoarding room, there's so much more space to move. So the joint is so much freer to move all over the whole surface. So sometimes it'll rock, some of the tendons might roll over each other, find a place again. There's so much more space for everything to move. But if there's pain, that's is when it's a little more concerned. So be a little aware of if it hurts when it pops, or if it's just popping and no pain involved. And remember, most people that are having surgeries in general, this is another thing I tell them, is that when we're younger, our surface is smooth, our cartilage is smooth. But as the choices we just make as growing up, jumping out of a tree, jumping off a swing, yada yada yada, it gets a little rougher. So you can see why it might be popping, because you have cartilage and you have other soft tissue, connective tissue that's either floating around or dislodged from the joint. And if you have any more questions, feel free to call me at 565-667-8871. Thanks. Have a good day.